So now section 2, axillary region. Okay, again, don't be intimidated with all the words here. It's actually easy for you to learn with pictures. Just here I want to show you that we're going to learn about structures in the axillary region, particularly the cervical. The other name is cervical axillary canal. Okay, let me show you the picture here. Okay, this is what I mean by cervical axillary canal. Why cervical axillary canal? Because it involves axilla and cervical region here, whereby you can see that the apex of the canal is surrounded by anteriorly by clavicle, medially by first rib, and posteriorly by scapula. Okay, here, and the base is directed inferiorly, skin of concave armpit. Basically, we can say that the base is ketiak. Okay, and it is stretched between anterior and posterior wall. This is the anterior, sorry, I think I should mention it, anterior and posterior axillary fold. Okay, whereby it shows here this is the base, the ketiak, the anterior axillary fold formed by inferior border of pectoralis major, and posterior axillary fold formed by latissimus dorsi and teres major. Okay, and we have covered the apex of cervical axillary canal, base, and the walls and content. Better we use pictures lah. Okay, for the wall, it has 4 walls: anterior, lateral, posterior, and medial. Okay, for the anterior wall, this is the sagittal section. Okay, you can see the anterior border or wall consists of pectoralis major and minor. Okay, this is pectoralis major and this is minor. The medial border consists of thoracic wall and serratus anterior. Okay, the green colored here. Okay, the posterior wall by subscapularis. Okay, the muscle that located anterior to scapula. Okay, teres major and latissimus dorsi. And the lateral border is intertubercular sulcus. Okay, here you can use the picture here or picture here, it doesn't matter. And for the content, okay, this is basically the same, the borders and the content here. When you said axillary canal, cervical axillary canal, you know it's at the area of axilla, so the content should be those that has axilla name as well. Okay, so for example, the content is axillary lymph node. Okay, this axillary lymph node, axillary vein, and also this is cord of brachial plexus with axillary artery in axillary sheath. Okay, why I should mention cord of brachial plexus? Because brachial plexus have we will go through after this. Brachial plexus have 5 separate parts, divided by 5 separate parts, which are root, trunk, division, cord, and branches. So this is where the cord is. Yeah, cord of brachial plexus located in the axillary cervical axillary canal. Okay, other than lymph node, artery, vein, there is also muscles here, which are coracobrachialis and bicep brachii muscle as part of the content. Okay, some book mentions that pectoralis minor is one of the content in cervical axillary canal. Some book says it acts as anterior wall of cervical axillary canal. So either one is acceptable to me, and this is the link for the video for axillary canal. If you want to have a better understanding, you know, other videos to look at, you can watch this. So this is what I've mentioned earlier, brachial plexus. Don't worry, we will cover brachial plexus in one specific lecture. Just to give a brief idea for you, brachial plexus from C5, as you study the picture, okay, from C5 to T1, okay, and it emerges in between scalene, anterior scalene muscle and medial scalene muscle. Okay, it has 5 parts, 1, 2, 3, 4, 5, which are roots, trunks, division, cords, and branches. Okay, Randy Travis drink cold beer. Okay, root, trunk, drink division, cold, cord, beer, branches. Okay, so basic from the picture. Don't bother about the words from the picture. We have cervical plexus from C5 to T1, have 5 roots, then converge to become 3 trunks, superior, middle, and inferior. Then divide again into anterior and posterior division, from 3 trunks to 6 division, 3 anterior division, 3 posterior division, and then cantum balik, converge again back into lateral, posterior, and medial cord in relation to axillary artery. It is named as lateral, posterior, and medial in relation to its position to axillary artery. Okay, this posterior cord located posterior to axillary artery, this lateral cord located lateral to axillary artery, and so on and so forth. Okay, from this cord will emerge these are 5 main innervation for upper limb, which are musculoskeletal, axillary, radial, median, and ulnar nerve. Okay, and these are just pictures to show you, okay, the posterior triangle of neck. Okay, here I won't go deep into this because you will learn this in head and neck anatomy. Yeah, as I mentioned before, this it emerged from in between anterior scalene and medial scalene, middle scalene, sorry. Okay, this is brachial plexus. Okay, and this is a video for you to watch, a simple way to remember. Okay, brachial plexus. Okay, now we move on to another structure. Okay, we in section 2 right now, axillary region. We've covered about the content of cervical axillary region, axillary canal. We've mentioned about brachial plexus. Now axillary artery. Axillary artery is originate from subclavian artery, lies deep to pectoralis minor. Okay, here this is the point of reference. This is pectoralis minor. Okay, look at the picture. This is subclavian artery. Once it's passed by the first ribs, it becomes axillary artery. Okay, subclavian artery passed by this first rib, it becomes axillary artery. Axillary artery divided into 3 parts, which the first part proximal to pectoralis minor, second part behind or posterior to pectoralis minor, and the third part is distal to pectoralis minor. Okay, so this is a picture showing you the branches, the main branches of axillary artery. Okay, as I've mentioned before, this thoracoacromial artery, the one that innervate pectoralis major and subclavius, and superior, and also together with superior thoracic artery and lateral thoracic artery, supply pectoralis minor, serratus anterior. Okay, so this artery are branches from axillary artery. And what about this? Okay, yeah. Posterior circumflex humeral artery. Remember this? We mentioned this in the quadrangular spaces that supply rotator cuff muscle. Okay. What else? Okay. So if you can see the bold in white, I hope you can appreciate it. Bold in white are the main branches of axillary artery from first, second, and third part. You can remember it by 2 thoracic, okay, superior and lateral, 2 circumflex, posterior and anterior, 1 thoracoacromial, and 1 subscapular artery. Okay. What else? Okay. Let me show you. Okay, when this axillary artery, okay, pass by lower border of teres major, it becomes brachial artery. Okay, as you can see here. Okay, for example, right subclavian from brachiocephalic trunk, subclavian pass by first ribs, become axillary artery. Axillary artery pass by teres major, become right brachial artery, and at cubital fossa it will divide into right radial and right ulnar artery. Okay. And okay, this is posterior and anterior circumflex humeral artery also important for you to know, because it forms anastomotic network around surgical neck of humerus. So whenever you have fracture here, this artery, posterior and anterior circumflex humeral artery, might have a risk of injury. So you might have a vascular injury in a patient with neck of humerus fracture. Okay. Okay. Next is axillary vein. Okay, we've covered brachial plexus, axillary vein, axillary artery, axillary vein. Okay, axillary vein. It has superficial and deep vein, lymphatic drainage. Both have superficial and deep. Okay, for superficial vessel, we have basilic and cephalic vein. I hope you guys know this. Okay, we have for superficial and deep. Yang deep, they can follow artery, so you don't have to worry. So if you have a radial artery, you have a radial vein. You have ulnar artery, you have ulnar vein. Okay. For superficial vein, you have basilic dekat dengan badan kan, dekat dengan badan, so basilic here. Okay, cephalic terus ke kepala. Okay, basilic and cephalic. Okay. Okay, then so basilic vein yang superficial, dia akan merge, okay, combine with a brachial vein. Brachial vein is the deep vessel. Okay, they can combine at the level at the border of teres major. Okay, basilic vein superficial combine dengan brachial vein deep vessel, and dekat teres major combine to become axillary vein. Yeah, while cephalic vein, it will travel upward to go between deltoid and pectoralis major and enters terus. Okay, cephalic directly towards axillary vein. Okay, let me show you here. Okay, this is cephalic vein through deltopectoral groove and drain into axillary vein. Okay, you can see from picture here. This is a radial, okay, yang deep, yang gelap, superficial, yang cerah. Ya.